Namaskar, good evening. Myself is Dr. Archish Khivsara. I'm working as an assistant professor in Pacific Institute of Medical Sciences, private medical college here at Udaipur. Today, I would like to talk briefly on this year's World Mental Health Day theme, 2025. That is access to services, mental health support in catastrophes and emergencies. Now, this highlights the importance of providing mental health and ensuring mental well-being in times of disasters and other calamities like in emergencies, humanitarian emergencies. What we need to realize is when these emergencies strike, when these events occur, people go through a lot of mental problems, and 1 in 3 have been found to have mental problems, and in fact 1 in 20 have found to have serious problems. So making sure that mental health services reaches them, and we ensure their mental well-being not only saves lives, it also gives the most affected people, the most vulnerable people at that time of the event, at that location, at that point, at that spot, space to heal, and rebuild their community. And also to ensure this, we need to have a proper support system. So from all walks of life, as in not just the mental health professional, the government officials, the health staff, we need to come together to help these communities, help these people affected by these calamities, the disasters, the emergencies, humanitarian emergencies, to rebuild their community, get back to their life, and lead a normal life later on. It is very important that we all come together so that we just not foster well-being in long term of these people, of these affected communities, but also ensure that the mental health services are always available to them. All these services are also available to them. And the other thing, the most important thing is we all should work together, come together, ensure that the mental health and the mental health services, these are everlasting. They're always accessible, they're always available, they're everlasting, and always there, and people can always access to it. The most vulnerable population, the most vulnerable group of people can always have access to it. So we need to make sure that we empower the people to rebuild the community, build society, get back to their life, and make sure that the mental health and is always protected, valued, and always recognized as a very, very important integral part of our life or daily life. It is like, as I want to say at the end, it is like good food. Good food, and probably put it in a good the mental health can be put in a way of good mood. Both are important, and we need to make sure that the good and healthy food is accessible to everyone the same way. This mental health is accessible to mental services accessible to one, and we ensure their mental well-being. So coming back to the mental health theme of this year, Mental Health Day, that is 10th October, access to services, the mental health well-being in the humanitarian emergencies. So what we need to ensure is that the mental health will be is always available, accessible at these times of events, when these catastrophes occur, and when these calamities strike, the humanitarian emergencies. We need to make sure that the mental health being is always valued, protected, always accessible at all times. And it is like, as I want to say at the end, we can put it as compared to good food. So it should be freely accessible, always available to the vulnerable population. Thank you so much. Jai Hind, Jai Bharat.